So now it's important that we know and understand this body that we're working on so that we give it the very best we can. I'm going to show you now muscle proprioceptors. It isn't important for you to really know these, but it's very interesting. I want you to just get a view of the gamma nerves and the alpha nerves in order to understand that it's very complex. The muscle fiber itself is made up of long fibers and short fibers. The long fibers move fast, the short fibers move slow. Here are the shorter fibers of the muscles on the inside of this muscle tissue. These are the long fibers. The long fibers respond very quickly to nerve impulse. If we take a blow, we will jerk immediately. But where do we get the control for slow, even muscular movement as we're going through any kind of body function? A simple walking takes a lot of muscle groups working in correlation with each other to both stabilize the body and help it to move about. This comes about by the short muscle fibers being very slow to respond and hence holding back this spring-like function we would have in the long muscle fibers. If you've ever seen one with cerebral palsy trying to walk, they have a great deal of difficulty controlling the musculature of the body. They flop around a lot. They have a lot of spasms. As they walk, it's more of a spastic walk than a smooth gait. And it's because they don't have complete control of all of the muscles of the body, because the nerve function is impaired. So the nerve muscle or the neuromuscular function is impaired, and we get a jerking motion instead of a smooth muscular motion. This is brought about by these muscle proprioceptors. Neuromuscular spindles are located throughout the muscle, with a higher concentration in the central belly portion. The concentration of neuromuscular spindles is dependent upon the type of muscle in which they are located. The function of the neuromuscular spindles is entirely on a subconscious level, giving no sensory perception. They have both afferent and efferent nerve communications. The communication they send to the spinal cord and cerebellum is necessary for control of the muscle in which they reside. The muscle spindle varies in length from 2 to 20 millimeters and is enclosed in a sheath, making a fluid-filled cavity. Within the cavity are 3 to 10 small muscle fibers, which are called intrafusal, to differentiate them from the larger skeletal muscle fibers, which are called extrafusal. The intrafusal muscle fibers are much smaller than the extrafusal fibers. The intrafusal muscle fibers are attached to the extrafusal muscle sheath, so the intrafusal fibers are stretched or shortened with the extrafusal fibers of the neuromuscular spindle. It is within this intrafusal fluid-filled cavity that the sensory receptor area is located. It is supplied by 2 types of afferent nerves. Type IA, which is located around the muscular bag, or the nuclear bag. Type 2 fibers in the contractile part of the intrafusal fibers. The IA fiber is large and has a high velocity of conduction, while the type 2 is significantly slower. So this gives us inner muscle control, controlled by the cerebellum. The cerebellum is that portion of the brain, the lower lobe of the back of the brain, that has learned since childhood the function of every muscle of the body. So the cerebellum has actually memorized every movement that the body can possibly make. If you've ever watched a child, a newborn baby, as it begins to find that it has hands, First it just sticks its finger in its mouth because that's the thing to do. Then it discovers it has two of them. And then it discovers it can reach out and touch things. Then it discovers that it can reach out and pick up things. But if you'll notice, a baby always reaches out to the center of its body with both hands at first. And then as it discovers it has more control, it reaches out to its sides. Then it finds its feet. And then it finds that it can get its feet in its mouth. Now, I can't do that, but most babies can. I'm told when I was a baby I could get my foot in my mouth, but there are a lot of people who say I do have my foot in my mouth a lot, but I can't get it up there physically. But as we discover our bodies and its function, we discover, or the cerebellum learns how that muscle is to function. So by the time we have learned to walk and to run, by the time we're 5 and 6 and 7 and 8, our bodies develop the ability to run and jump, to climb, to fall, to roll, to do all of the functions that the human body is capable of doing. Then when we learn to dance, we aren't learning how to move our body, we're learning how to control the body movements. And the cerebellum, as we're learning to dance, the cerebellum memorizes for us those muscle movements so they become automatic. So now so dancing to music almost becomes an autonomic function, doesn't it? You hear the music and you start going in the rhythm of the music and you've learned the steps and it seems almost autonomic. It really isn't, it's just automatic because we have taught the cerebellum what the body can do. I had a little boy brought into me one time who had been injured at birth. He was so large that both shoulders were broke. One knit and healed properly, and the right one did not. As a result, he had no movement in his right arm or shoulder. The physical therapists were doing what they had been taught to do, and that's force that joint to move. It was very painful for him. He just despised it. And he just cried and yelled all the time they were working on him. They had about decided what they were going to have to do is break the elbow because it wouldn't straighten and put it straight. And the mother came to me in desperation saying, I can't see him doing that because then all he'll do is have, instead of his elbow stiff up, it'll be stiff down. And I said, well, let me see what I can do. I worked on him for a few weeks and I got almost normal function in the shoulder. And I got the elbow almost entirely straight, not quite. Now this little boy was about 2 when I started working on him. I worked on him for about 9 months. And what I did was improve the elasticity or the flexibility of that shoulder and that elbow. But he couldn't use it. And his mother says, well, you know, you've got it moving good for him. This is after we'd worked on him about 3 months. But he says he doesn't use it. And I said, that's because his brain doesn't know it's there. She says, what? And I said, the cerebellum has learned the function of every muscle of his body because he discovered it and used it. He never used the right arm. So what I'm doing to him now is teaching his cerebellum that he has a right arm and that it moves. She says, how are you doing that? And I said, just through the range of motion work I'm doing. And I said, this is what takes the longer time as I work on this little boy. So we continued the therapy. Like I say, it took about 9 months of working on him. But pretty soon he was reaching out and taking hold of things with his right arm. And the most exciting thing she saw was one day when I'd finished therapy, he jumped off the table. He was still in diapers. He was a real hellion, let me tell you. Just a busy little boy that was just everywhere. Belligerent, loud, and fun. He jumped off the table and he ran over to the door and he reached up with his right hand, grasped the doorknob, turned it, and opened the door and headed off as hard as he could go because he knew his mother didn't want him out there. she missed 2 or 3 steps going to catch him because her eyes were so full of tears because she saw her little boy reach out and use that hand almost normally when she had been told that he would never, ever have use of that right arm. And of course, if you believe that, it's true. You'll never have use of it. But if we teach the brain that it's there, then at any age we can learn to reuse those limbs if they are functional at all. And this one was, once we got all of that tension and stuff worked out of those muscles. And it didn't take this little boy very long to realize that this therapy was fun, not painful. So we had a lot of fun working on him, but we had excellent results. You hear all of the time people who receive a minor brain injury and then they can't walk. If the cerebellum is injured, then we may lose memory of some of the use of the muscle function and have to relearn it. It can be relearned in most instances. Yes?
2 questions. If a person has amnesia, is it usually in the cerebellum that the brain has been damaged?
Amnesia? No.
No.
No, amnesia may be just simple memory loss and not loss of muscle function.
And in retraining a part of the body that the person doesn't know because they haven't used it, is what you use range of motion or?
Well, we use a lot of things. As we are retraining the body, the cerebellum must relearn or learn from the beginning what those muscles can do, and it takes a long time to get it to learn it. It isn't something you're going to do overnight. So it's something we got to always take into account as we're working on people. Acutherapy now is a combination of acupressure and polarity therapy. And its function is addressing the Golgi tendon apparatus at either end of the major postural muscles of the body and influencing those proprioceptors that reside there. That's really the basis upon which we work with acutherapy. As we touch the body, we want to remember that every muscle has 2 ends, and we try as best we can to touch both ends of those muscles at least one time or another. So in working, today we're going to demonstrate the neck and the face and the head. And as I go through it, I'm going to name for you those muscles or muscle groups that I'm touching so that you'll sort of have landmarks to follow. And we're going to let the camera come in close. You can look at the TVs from the monitor screen, or you're welcome to stand and look around here as long as you don't get in the way of the camera and its lights. I usually touch with the middle finger of each hand. I often touch with the thumbs and the forefingers. I never touch with the forefinger of one hand and the middle finger of the other hand. And I'll briefly explain why. Dr. Stone's theories of magnetic healing, of polarity, are that the thumb is neutral of the right hand. Now I'm talking about my right hand. Thumb is neutral, forefinger is negative, middle finger is positive, ring finger is negative, little finger is positive. The front of the palm of the right hand is positive, the back of the palm of the right hand is negative. Conversely, on the left hand, the palm is negative. The back of the hand is positive. The thumb is neutral. The forefinger is positive. The middle finger negative. The ring finger positive, and the little finger negative. Hence, when I touch with these 2 fingers, I have positive in the right hand to negative in the left hand. So then by touching the body with a positive and negative finger, I set up a transmittal of energy from positive to negative. The energies of the body always flow from positive to negative. According to Dr. Stone's studies, energies flow out of the right hand into the left hand on a continuum. So, knowing that now, as I work on Roman here today to demonstrate this to you, you realize he has negative and positive fields within his body. And it can become very, very intricate in trying to separate these fields as we're working, and we don't do that. In this technique, we don't have to. But we have to remember that every muscle has two ends, okay? So it attaches to bone on either end, and in each end of that muscle are Golgi tendon apparatus loaded with proprioceptors that are there to protect and monitor that muscle and its function. So, to begin with in the head, I cradle his hand or his head in my hand. Doesn't matter which side you start on, except that if he's in pain. If he were in pain on the right side, I would start on the left side. If he had a muscle spasm on the right side, I would start my work on the left side. The reason being that I would influence the left side to begin to relax and release the pain and tension of the right side, so that when I get to the right side, I'm not causing pain as I touch, and it does work. I have my middle finger under just inferior information, and if you haven't gotten that far in your anatomy yet, inferior means below the mastoid bone. So my finger is inferior or below the mastoid bone. I said that in such a way as that inferior may have sounded like it meant below the mastoid bone. That's not true. Inferior means below, and so my finger is inferior of the mastoid bone. I am influencing, the first muscle I want to influence is the sternocleidomastoid muscle, which is the muscle that, if you'll remember now from our brief anatomy discourse, it attaches to the clavicle and to the sternum and to the mastoid. Hence its name, the sternocleidomastoid. To begin with, I cradle the head in my hand, in my palm, with my middle finger touching the attachment of the sternocleidomastoid on the mastoid bone, which is inferior or just below the mastoid. My opposite finger I touch with my thumb first, being a neutral finger, and I touch the clavicle itself, and then I roll down in so that I'm on the attachment of the sternocleidomastoid. Now, as I touch this, I feel an energy flow, and I feel the muscle respond and relax. You feel that letting go, Roman? Mm-hmm. And you're going to have to watch me really careful because I have a tendency to shortcut. Marv is going to help me not to shortcut and confuse you, because when I feel it go, I quit. But as you're doing it, remember I told you that therapy is much like, as you begin, is much like doing a dot-to-dot drawing or a paint-by-the-number painting. You use a certain color in number 5 and another color in number 7, and when you're all done, you have a pretty nice-looking painting if you've been careful. Your therapy with acutherapy is much that way. You go dot-to-dot at first. So you'll hold this point about 4 or 5 seconds. The next thing you want to do is use what we call the knife edge of your forefinger, which is the front edge of your forefinger. You bend it slightly and you use your forefinger and thumb as a pincer, like this. Does that show up so everybody can see it? Okay, and you turn your wrist and twist your arm in this manner so that you're able to grasp the sternocleidomastoid on the medial portion with the side, the knife edge from the last knuckle to the tip of your finger, and then you grasp the back of the muscle or the distal part of the muscle with your thumb. You do not pinch, you merely grasp it and hold. And you will feel that muscle tissue respond and begin to relax. Hold it 2 or 3 seconds and move up just the width of your thumb and finger. And then move up again, following that sternocleidomastoid, as you're coming up. And as you move up, you'll feel it relax. You notice how I just move his head a little bit and allow that muscle to stretch and open up as I relax it until I get to just under the ear and my thumb is actually touching the mastoid. Then I turn my finger around and I use my middle finger on the attachment of the sternocleidomastoid to the mastoid bone itself, and I just touch the attachments. Now, when I touch that attachment, I'm touching proprioceptors in the Golgi tendon apparatus. That brings about the relaxation that I want. I then use the middle finger still, and I touch the muscle of the auricularis. Auricularis, meaning the muscle that goes around the oral canal or the ear. And I touch it with just this middle finger, about a finger's width apart. And you notice how gently I'm touching? How hard does that feel to you, Roman?
Weight of a marble.
I would say 5 grams. The weight of a nickel, that's about 5 grams. That's a good way to put it. Most of us don't carry marbles anymore, but we do have a nickel or two. I go all the way around the auricularis, which takes me back to the mastoid. Now I've relaxed the muscle tissue around the ear. I come up and with my forefinger, now I can't always explain why, but I can tell you that there are 2 reasons involved in everything I do in acutherapy. One is the practitioner is entitled to his or her comfort as they work. Time is money, and so if you can bring about the greatest amount of relaxation in the least amount of time, you haven't overcharged your client and you've been able to make a fairly decent income in what you do. So we don't want to waste our time and our motion and our energy. We would like to be able to work on more people during the day. In my practice, it's common for me to work on 40 to 45 people in a day. Well, if I'm going to do that, I have to economize in body motion to conserve my own energies. So one of the reasons that I do acutherapy the way I do it is to conserve my energy. One of the other reasons I do it the way I do it is because it brings the greatest results. Years and years ago, I used to do time and motion studies. And so I learned that motion and the number of movements you make in a given period of time are really important. Now I'm doing the masseter muscle. That's the large muscle at the cheek that helps us masticate or chew our foods. And I'm touching it with the tip of my forefinger. I can't tell you exactly why, but I've discovered that that finger is the one that gives me the most relaxation on the masseter. I follow it clear up under the cheek. Okay? I then do, what do I do next? I've done the masseter, and I come up here and I'm to the cheek. That's right. And then I do the other side. Well, I do them second. So then I change hands, and I put my middle finger now under the mastoid bone on the opposite side. Right there. Cradle the head. Notice how much more relaxed the head is becoming. You can feel quite a bit of relaxation, can't you?
Yeah.
Now, I do the same way. I lay my thumb on the clavicle and roll it down. Not a lot of pressure, but I just roll down in the attachment and hold it about 5 seconds. I'm holding it for your benefit 5 seconds, but it's totally relaxed now. Then I grasp the same way. And this is a little unhandy at first, but you twist your wrist around and you grasp that muscle like this. And then you move up the muscle, grasping that muscle, clear up to its insertion. Then I change my finger and I go around the auricularis, gently touching. When I get to this point, I usually change to 2 fingers It gives me maximum relaxation over that broad muscle, and I didn't show you that on the other side. But it's a good way to do it, is touch with those two fingers, and it does relax it nicely. It doesn't matter in that case. Then I do the masseter with my forefinger. See, his is pretty tight right here. So I can tell Roman has been under quite a bit of emotional stress and tension. What Roman doesn't realize is that as I work on him, I can read his body and I can tell you a lot of the things he's been through in the last while because of where the tension resides in his body. Relax that nicely, you see. Okay? Always cradle the head and move it gently. Don't let it flop around. Okay? The next one we want to do now is the orbicularis, or the muscles around the orbs of the eye. So it's called the orbicularis. What you want to do is you want to touch that with the knife edge of your thumb, with your thumb in this position here. You want to get down and address the eye itself. Actually, let the tip of your thumb touch the eyeball. By so doing, your client will realize that you know where you are, and they will trust your finger, your finger as you go around the orbicularis. Very relaxing and very powerful on the sinus cavities. Really drains them. And then I take my thumb tip and I go in and I touch the inferior portion, or the bottom part of the orbicularis. Just with the tip of my thumb. Then I do the opposite eye. No pressure. We're at 5 grams. Are we not, Roman?
Right.
How's it feeling?
Well, I've dozed off a couple times. I'm doing well.
We'll let you know if we hear you snore. Now the tip of my thumb on the inferior portion.
Wish I could all feel the muscle melt when you
It just relaxes, doesn't it? It's just like a hot knife on butter. Now the frontalis. Both thumbs together. No pressure. Just touch the muscle. Moving medial to lateral. Medial meaning the most central portion of the body, to lateral, the most distal portion. Right across those corrugator muscles. See, the corrugators are here. That's an interesting name, isn't it? It allows you to pull your eyebrows in and actually corrugate the eyebrow, and it's called the corrugator muscle. Come all the way around to where I was before by the zygoma. And then I come up and I do a second track. I'm approximately a ½ inch or just a little bit further up now on the frontalis, and I touch all of the frontalis muscle very gently. Now remember, you want maximum relaxation. Maximum result calls for minimal pressure. You can remember it that way. So we use the least amount of pressure possible to get the maximum benefit that we want for our client. Third trip across the frontalis. That feels very relaxed, doesn't it? Now, you remember in our anatomy we talked about the scalenus muscles. We influence the scalenus muscles in this area, just behind the sternocleidomastoid, and we can reach in there, and there's a very powerful point, approximately 1.25 inches inferior of the ear itself. And what you got to learn to do is be sensitive as you touch those points, and you'll find that right in on the scalenus, and it will relax all of those muscles. Feel it going? He's gone to sleep.
Well, Jim talks about colors. All of a sudden, I'm getting a flash of green, blue, white.
And then there's one that influences the hyoid muscles and the hyoid bone itself, and that's just superior about 1/4 of an inch and medial of the sternocleidomastoid. And I gently touch it. And that relaxes all of those deep muscles that I showed you in the anatomy lecture. So we've relaxed these muscles. Same thing on this side now. I go in right there, and there it is. Relax that nicely, and it's just melting under my touch. And then influencing the hyoid muscles and the hyoid bone itself by touching right there. Now, I want to do the trapezius as it runs up the back of the neck. And I want to go down to T1, C7. Remember how I told you to locate T1, C7? It's that hump at the base of the neck. Now I'm lateral in the belly of the muscle. Now the belly of the muscle, when we use that term, we mean the highest portion of the muscle that we can touch. Its center. And I'm holding it this way with the 2 middle fingers. So I'm generating an energy across this way between the 2 fingers. Then I move up to C6, staying on the belly of the trapezius. Now, knowing my anatomy and knowing what's going on, I can tell you that he's got a problem with the scapula on the right side, because I can feel the levator scapula in there throbbing and pulsing as it tries to release. And now I see his right shoulder relax and drop. Did you see it drop? Did you feel it drop?
I didn't.
You're asleep. His right shoulder just released for me because I released that musculature down into the scapular area so that it could let go. Now I'm at about C5, just touching, and now again you're tempted because you're underneath to lift it up and put a lot of pressure, and don't do that. Minimal stimulus brings maximum result.
On acutherapy, you just work the head?
Oh no, there are 6 sessions you're going to learn. You will work the entire body. Okay, now I'm up at the occipital protuberance. Remember where I told you that was? I'm lateral at the occipital protuberance on the attachments of the at the attachments of the trapezius on the occiput. And now what I want to do is come up a little bit further, and now I'm right on the occiput, but I'm on the muscle called the occipitalis. That's where headaches reside. That can be very painful in headaches. And again, no pressure, gently touching, and now I'm going bilaterally, meaning I start at the occipital protuberance and I move lateral with both hands simultaneously out to just almost the mastoid bone. Then I go back in, I move up a fingertip width, and I follow that around again. And see, he's got a little throbbing on the left side. So we have a little crossover tension, a little that corkscrew winding up that we often see when people are in a lot of stress. And that finishes it. Now I've done the neck, both posterior and anterior. I've done the facial muscles and relaxed them very nicely. So let's have Roman sit up now.
Use on fingers 2 and 3, both concentration. Sit. Thank you.